Well, good afternoon, everyone. Welcome to this very special live event, Protect Your Spine, When to Seek Care. This event is courtesy of Banner Health. I'm Eric Sperling. I'll be your host and moderator today. We have some of the top minds in the field. We're so excited. Joining us live today, Dr. Peter Du is with us, Dr. Abdul Jabbar Al-Hamoud is with us, and Dr. Richard Chua will be here. All fantastic and talented members of the spine team. We look forward to chatting with all of them in just a moment. But first, some quick housekeeping items because this is a live stream event. So if the stream goes down at any time or you're having connection issues, we recommend just logging off, logging back on. That tends to fix it. This event will be available to stream and share on demand once the show is over. Now here's how the show is going to work. We're going to bring up our doctors one at a time to go over some key related items to spine care and then the patient journey. Then we're going to have a panel discussion with all of the doctors, and that's exciting because we invite you watching at home to submit questions throughout the show using that chat feature on your screen, and we will try to get to as many of those as we can. All right, it's time to get started. Let's meet our first guest.
My name is Peter Du. I'm an orthopedic spine surgeon at Banner University Medical Center in Tucson. Spine care is very personal to me because I have many family members that have been affected by spine issues, and I have seen firsthand how debilitating it can be to not only the patient but their loved ones as well. My patient care approach is to treat each patient uniquely and not the images I see on the screen. The key factor in a patient-physician relationship is trust. I trust that the patient is being honest with me and that the patient trusts that I have their best interest in mind. Communication is key to a good outcome. I rely on patients to communicate to me how they are feeling, and patients rely on me to communicate to them all their options so they can treat what they feel is best for them. Nothing makes me happier than seeing a patient have a good outcome and be able to return to the things they enjoy doing that they weren't able to before. I would want a patient to say that I was a very caring physician that listened closely and treated them with respect.
All right, great to see Dr. Du with us live on stage. Thanks for being here.
Thanks for having me.
Okay, we're going to start broad. We're going to have this little discussion here on spine care, but I want to ask you about the state of spine care, how it's evolved over the years, where we are today. If someone were to ask you in general, what's the overall state of spine care, how would you answer that question?
I think the state of spine care is it's really exciting. You know, the advancements that have been made in the past couple of decades is really astounding. I just saw a patient actually this week who had his neck surgery done back in the 90s, and compared to how we do it now is completely, some things are, you know, the same, but the technology we have is so wide and different. It's really exciting kind of to see where it's going to go.
Yeah, not only where it is, but where it's going to go. Let's talk about some of the common issues that you and your team see. There's so many things, obviously, when we're talking about spine care, but what are some of the more common things?
You know, we see a lot of degenerative conditions. You know, everyone as we, you know, age, we start to develop back issues. You know, we see a ton of that. We see a lot of, you know, deformities, you know, when your spine's kind of growing a little crooked. You know, we see a lot of back pain, we see a lot of leg pain, a lot of nerve-related issues, and then our team also deals, you know, with some pediatric issues as well.
What are some of those pediatric issues that your team handles?
A lot of it's, you know, like adolescent idiopathic scoliosis. You know, I remember when I was a kid in elementary school, we'd all get screened every year. The nurses there for scoliosis. You know, we see a lot of that. And a lot of sports-related conditions too, you know, stress fractures and the like.
I think we're going to give you a backup mic here so we can hear you a little bit better. Perfect. Let's follow up that question on degenerative diseases. Is there a certain age where you just see that more commonly, or are we always seeing it? Are we starting to see it in younger populations?
Yeah, you know, it's actually very common. You know, I think, you know, when we look at studies, if we were to x-ray people, you know, I told my patients over the age of 50, you know, 90% of people over the age of 50, if you x-ray them, have signs of wear and tear on their spine. You know, it's when that wear and tear becomes thematic is when, you know, we come in and, you know, intervene.
Okay, we're going to be talking a lot about how we address some of those issues coming up. We've got our other doctors coming up. For now, let's meet our next guest.
I'm Abdul Jabbar Al-Hamoud. My patient call me Dr. A. I'm orthopedic spine surgeon at Banner Health. I chose spine surgery because of challenging and complexity of spine pathologies and the ability to build up long-term relationship with the patient and families. By taking holistic view of unique patient conditions, needs and goals, I offer tailored, personalized treatment plan that maximize patient outcome and quality of life. My relationship with the patient built on foundation of trust, effective communication, and comprehensive care. So I like my patient to say about me that Dr. A did not treat me as a medical case. He treated me as the whole person. He listened to my concern, answered my questions, and involved me in the decision-making process.
I love this. The couch gets bigger. All right, Dr. A joining us now live in studio. One of the questions I have for you, this is a very common question. When is it time to see a spine doctor? Is it because I'm experiencing some sort of pain? Is it limited mobility? How does that patient journey start? It's like, okay, it's time to see you.
So actually it's a combine of all what you mentioned. So basically if you have back or neck pain that lasted more than a certain period of time despite your rest and take out-of-counter medication, or if you have pain goes down to your arm, goes down to your leg, and if you are like elderly, like more than 65, and you have difficulty in walking, you can't make it to the mailbox anymore, or you have difficulty in posture, like you can't stand straight, you can't sit straight, that's the things that you should seek a spine specialist, and that can look it up and try to figure out a way to help you.
Dr. Du was just talking about that, pain going down the leg, pain going down the arm. Is that always an indication that there's something going on in the spine, or that could be something else?
I mean, we'll be more concerned if the pain goes down to the arms or the leg. That means there's a nerve pinch or the nerves start to be affected, more than pure the back and neck pain, which is most of the time muscular. So that, you know, like push you guys to go to see a spine surgeon or a spine specialist to figure out if there's a pinched nerve or a narrowing pushing on the nerve or disc herniation. That with sometimes with a very tiny procedure we can, you know, set you back to your normal leg.
All right, you just said the magic words, tiny procedure. And Dr. Du was talking about the advancements we've seen over the years when it comes to spine surgery. And in our, you know, we have these pre-production calls, we talk about some of the things we want to talk about on the show. And you mentioned a couple of things, and I want to start with ultra minimally invasive, because we've heard about minimally invasive for years, but it's the first time I've heard you mention ultra minimally invasive. So we're just getting smaller?
So the ultra minimally invasive is actually, you know, like the whole idea to go and target the spine problem directly without affecting the collateral tissues around it. So basically with a small incision, maybe 7mm incision, putting the camera and a working tube, and we go and directly target that pathology, whereas in traditional spine surgery you have to cut, pull the muscle away, and that muscle can be atrophied. So it's more like less collateral, and that's why, you know, like patient, and even though surgery can be done awake in certain circumstances, like patient cannot get anesthesia for heart issues and other things, and those patients go home the same day, return to their daily activities is a very short period.
I've seen surgeries where, yeah, they leave with a Band-Aid, basically.
Yeah.
Like that, it's that small. What about spine endoscopy? That's another thing you mentioned. You think endoscopy, you're thinking going down the throat, you know, and checking out things in the stomach with a camera. But what's a spine endoscopy?
Yeah, this is some kind of, you know, like people try to find a different name for spine endoscopy because people like confuse. Yeah, but basically it's using a camera. It's go through the working tube, and that just show us inside the body without need to open more bigger incision, and to do the same kind of procedure like pull the disc herniation or take the stenosis or the narrowing around the nerve, we call foraminoplasty, or decompression, without need to take all that bone and like directly target the main problem with a small camera.
So again, back to the patient journey. Obviously here in Arizona, a lot of opportunities, a lot of chances, a lot of different healthcare organizations out there. Can you talk a little bit, maybe especially in Tucson, what the the Banner method is, what the Banner, the comprehensive care that you guys provide? Talk a little about that process.
Yeah, basically, like we are lucky. We have, like orthopedic spine and neurosurgery spine there. So basically, both of us work as a one team, and like things that we provide, like comprehensive care from, like ultra minimal invasive endoscopy to maximum invasive like scoliosis corrections for adults and pediatrics, and people, and we're lucky to be there, and people lucky because we can provide those kind of complex procedure without need to travel to any other places.
Fantastic. And reminder for those of you watching in the Tucson community, this is live. If you do have a question, please use that chat feature there on your screen, because we're going to be getting close to having our panel discussion here. Before we do that, let's introduce our third and final member of the panel today.
My name is Dr. Richard Chua, and I'm Professor of Neurosurgery and Director of Minimally Invasive Spine Surgery and Spinal Robotics. I chose neurosurgery because it is the specialty in the organ system that we know the least amount, and I wanted to spend my career learning about how the brain and spine works, how it affects our diseases and conditions, to better understand how I could treat my patients. I can reassure patients that they will be fully involved in the decision making for their care, their treatments, and their diagnostic testing. I incorporate the patients and their families' wishes, their desires, and their goals for treatment, and we continue to provide a patient-centered approach. I feel great when patients come to tell me that they're glad they didn't have to have surgery. But when they have had surgery, I'm very grateful for the patients who have told me that their patient education, their skill for surgical techniques, and their education after surgery has helped them benefit from the surgery and return to a healthy lifestyle.
And Dr. Chua is with us now. I mean, one of these days we're going to actually show you behind the scenes. It's like a NASCAR pit crew. You guys coming up, changing out mics, moving seats, and we're all ready to go. Dr. Chua, if you can, talk a little bit about the difference, because we hear this all the time. There's orthosurgeons and neurosurgeons. You are a neurosurgeon. And, you know, what are the differences in those two, that when a patient is going, you know, looking for spine care, how do they navigate those two worlds?
Thanks for having me, and it's a great question, and we get that question a lot from our patients. What I generally do is explain to patients that we have a different educational path to get to where we are as spine surgeons. Okay. So some parents may send their children to public schools. Some parents may send their children to private schools or charter schools. At the end of the day, when we all graduate from high school, we should have that same basic foundation of knowledge and skill set. And so it's always great to collaborate with others who may have had a different educational preparation. But by the time we're all finished training, there's not a lot of difference in our skill set.
I asked Dr. Do this, what are some of the common things that you treat, that you see?
Really similarly to Dr. Du and Dr. Alhammoud. So the most common condition we take care of is patients injure themselves. They hurt their backs and they hurt their necks. Greater than 70 or 80% of the time, those actually get better without having to come see a surgeon or get any advanced imaging. But when we start to see patients with age-related conditions or unfortunate things like spinal infections or spinal cancers or tumors, then they need to see us for potential surgical treatment.
That's incredible. So 70 to 80% of the time they don't need surgery. So what is that process? I'm assuming it's physical therapy and getting back to, you know, motion.
Right, so I was cleaning out the garage a couple of weeks ago and hurt my back, and so I had to spend the weekend taking some ibuprofen and using an ice pack and doing some stretching on the floor, got in my hot tub and tried to get that better. And after a few weeks, if that's not getting any better, then the common thing would be to contact your primary care provider and consider perhaps a course of physical therapy. That might be twice a week for up to 6 weeks. But again, most of these things, typically the weekend warrior type back and neck problems will get better without needing to go to the emergency room, without going to see a doctor, or certainly not coming to see one of us.
So back injuries are common. You guys have probably all injured. So what do? Do you have a conversation with yourself? Like you just say, you treat yourself, or when do you go see somebody?
No, you do treat yourself. You know, sometimes we know too much, and sometimes we don't know enough. But if you sort of stick to the basics, and they've already highlighted, if you're having severe pain down your leg, which we call sciatica, pain or numbness or weakness in the arms or legs, then that's when you consider advancing and maybe speeding up the care and the access to care.
We hear about sciatica so often. Is that something that when you treat it, you cure it, or is it something that you just have to manage the rest of your life? And I'm sure it's different patient to patient, but how do you treat someone with sciatica?
It can be both. So I've talked a little bit about how we treat the acute episode with medications and rest, modifying the activities, maybe playing 3 rounds of golf instead of 6 rounds of golf that week for a couple of weeks, maybe taking it easy on the pickleball court for a couple of weeks. But occasionally it does need to escalate into some other treatments. Again, physical therapy, we work very closely with our colleagues, the pain management doctors, who sometimes will do injections to try to relieve pain. And then sometimes we need to do the MRI scans and x-rays to look for structural problems And sometimes structural problems have to be fixed with spine surgery to get the patients better, or sometimes we're really, more importantly, to educate patients on how to get better and how to prevent it from happening again.
Okay, yeah, you know your patient base, golf, pickleball. All right, so it is that time of the show where we're going to have our panel discussion. So as a reminder, if you do have a question, you can use that chat feature on your screen. We'll try to get to as many of those questions as possible, but we have had a lot of questions that have come in already prior to this show, and I'm going to kind of go through this, and what's going to happen is I'm going to read some of these questions. You guys feel free to kind of jump in. If somebody wants to take it or if somebody wants to add on, feel free. But I'm going to start here because we were talking about certain things to do prior to having surgery or not having surgery. Are there certain stretches or movements that I can mix into my routine to strengthen or prevent general back or neck pain? Dr. Dew, I'm going to start with you to make sure we've got a working mic on you, or if we need to bring the stick mic back. So have you answer that question.
I think, the biggest thing for me is for patients to, even when you're having some back pains, to stay active, not lay in bed all day, not stay on the couch, just some nice, gentle, low impact cardio like walking, treadmill, elliptical, a stationary bike should stay active, and then some very lightweight, exercises, body weight exercises, low weight lifting like 5 pounds or so, and then just gentle stretches of your, muscles everywhere, gentle range of motions, moving your neck around like that, stretching your back out, just as long as it's not causing you, to worsen your pain. I think as long as you're staying active, I think it's great.
So that's the key indicator, right? Like if you're doing these stretches and you're experiencing more pain, something's going on, and you should probably stop. Okay. There's always that sort of catch-22 with, like, hey, wait, I'm hurt, but you want me to move more.
Yeah.
And then if I'm moving more, I'm going to injure myself. But it is just a matter of moderation, watching that, and then, okay, something's not right. I need to go see one of you guys.
And I would like to add, like in including swimming in those kind of stretching, and that, swimming eliminate the body weight so they can do, more intense exercise but with less impact on their health. And swimming, one of the exercise to help build up back muscle too. So it's very important to include it in their, like weekly workout, and that is really good for spine health and back health.
Yeah, that's another good, our Arizona patient base. We have a lot of pools, so opportunity to go out back and get the weight off. Another question here. This is another common one we hear all the time. Is an ergonomic chair necessary for desk jobs? So we all work, 9 to 5, some of us, and we're sitting at the desk all day. And is an ergonomic chair necessary?
I mean, I get this question more frequent, and most of the time I said, like just find the chair that you're comfortable with. But, like ergonomic chair can provide, like appropriate alignment for your back, appropriate alignment for your neck, and, resting your pelvis and maybe resting your feet in appropriate position, and that keep your muscle not firing and not fatigue. And I think it's not a bad idea to have it, but it's not for everybody.
Okay.
And I'd like to add that probably more important than the type of chair you sit in is how you sit. And so a lot cheaper than an ergonomic chair is a physical therapy ball. And if you can train yourself to sit on a physical therapy ball where you're balancing and using your core muscles, that's really, really helpful to reduce future problems in the spine. And while the word exercise is kind of foreign to some people, including myself, I'm a big fan of recommending things like yoga and Pilates to my patients, and those are fun things during which you're strengthening your core and doing the things that to provide you with a healthy back.
I want to ask you guys about that, because one of the things that we talk about when trying to improve the strength of the spine is actually improving the strength of the core, right? We're talking about building up our abs, building up our core muscles, not necessarily focusing on lower back as being the source of where you need to strengthen, right?
Yeah, that's correct. And so all of the supporting structures of the lower back include the core muscles, the abdominal muscles, the side muscles, but also the big leg muscles, the quads and hamstrings and the glutes. So things like doing planks can be very, very helpful. And again, you don't need a gym membership. Right. You can do that at home on your floor. You can do it in your bed. You can do it on a physical therapy ball. A lot of things that can be done at home without being exercise.
Okay. We do have a good base of live viewers again. Please feel free. You guys can see how conversational this is. If you guys have questions, we're talking about everything from the type of chairs that you might want to be using, and we also have a question about pillows. So what are the best pillows for the side sleepers out there, myself included, to prevent pain?
I think, pillows are very, very subjective. Me personally, I like a really, really firm pillow. My fiance likes a softer pillow. I think, as long
Are you a
as
side sleeper?
I am all over sleeper, I toss and turn. As long as I think you're supporting your neck a little bit and you're not, keeping your neck hyperextended or flexed either way, as long as it's comfortable for you and you're waking up feeling refreshed, I think they all work.
All right, we'll have everybody weigh in on this one.
Yeah.
This is
I mean, sometimes
controversial.
sometimes adding a pillow between the knees can help relax your flexing a little bit your hips and relax your lower back muscle. That can like not keep you in like weird alignment that can add. And again, we see these questions almost every day in clinic, and there's no right and wrong answer. And you know what, very comfortable, but something like not too firm, not too soft, and just to fit the space between the shoulder and the neck, and make the neck in neutral alignment.
Very subjective, like you said. Okay.
Yeah, similarly, I think it's important to support the head and the neck. If any of you wake up in the middle of the night and sort of search for your pillow, it's usually underneath your head, but it's not underneath your neck. And so whether you're a side sleeper or on your back, you want to make sure your spine is well aligned. And so if you think about the distance between your shoulder and your neck, that can tend to be a fluffy pillow rather than a flat pillow. But again, it's really just about alignment and what feels comfortable.
Okay. Question about posture. Everybody's wondering about, can they fix their posture? Is it too late? Have I done irreparable damage? So let's talk about posture for a minute. And how much does that impact what's going on with the neck and the spine?
I think it have a big impact. I think there are people who just like me who slouch a lot, and you have poor posture. So I think you definitely work on that with daily exercises. There is a subset, like we were talking about, with scoliosis patients. Where your spine unfortunately has a curve to it. That I think is a lot harder to correct, in the sense that to get you fully upright without some more interventions. But again, those daily stretches, core strengthening, back strengthening exercises can all help to improve your support muscles to help get you standing a little bit better and helping with if you're having pain in your back.
Impact of posture on.
Yeah, I think everyone should come here and be on TV, because I notice we're all sitting here with
Well,
really
since we
good
mentioned
posture.
it, we do this.
Yeah, but so posture can be important, as Dr. Du has mentioned, but I think the more important thing about posture is it needs to be a habit. So if you're always having to think about your posture, then you're not going to have good posture. But we know from a lot of ergonomic studies of even surgeons that if we don't maintain good posture in the operating room, we actually hurt ourselves. And so it's important to have good posture. It's important to make that a habit so you're not having to think about it. And there is evidence that shows that good posture can help reduce problems with the spine.
So are some of those, whether they're braces or the things that you see advertised for posture correction, those gimmicks, are those really helpful?
So for certain circumstances, like if you have acute attack of pain or like trauma, the braces can help. But using those kind of braces for longer time actually has side effects, like the muscle will be lazy and then atrophied, and so it's not a good idea to use them for a longer time. So usually, we use it for a short period after surgery just to aid healing or after fractures. But most of the evidence supported that those muscles will get lazy, not working, and they will have more pain.
Okay, I want to talk a little bit about the diseases that you guys say happen, later on in a, 50, 60 degenerative type issues. What are some of the more common degenerative issues that you guys treat? And then what ultimately is that procedure that, as we talked about the state of spine care at the beginning of this, that has become either more common or you're seeing better outcomes with when we're talking about degenerative disc disease or something in the spine that's degenerative?
Yes, there's probably summarized into three diagnoses or categories. The first is spinal stenosis. Spinal stenosis is thickening of the bones and ligaments of the spine. When spinal stenosis becomes severe enough, it can push on or compress the nerves and give symptoms down the legs. The traditional surgical procedure for that is called a laminectomy, which means removal of bone, or we sometimes use the generic term decompression, all with the intent and the goal of relieving the pressure on the nerves and get patients up and around. The second major group would be called spondylolisthesis, and that's where the alignment of the spine is not correct because of degeneration and age-related changes. That implies that joint is unstable and moving more than it's supposed to, creates a lot of back pain or what we call mechanical pain. That operation for that is traditionally a spinal fusion with instrumentation to stabilize the joint with rods and screws and get the bones to fuse or heal together. And then the third category, which has been mentioned, is adult deformity or adult degenerative scoliosis. And that's where you have major curves of the spine, side to side or front to back, that can create disabling pain. That also requires stabilization and fusion in trying to straighten out the spine and keeping the rods and screws in there to keep the spine straight.
Great.
I would want to add for, like what Dr. Chua mentioned, like one of the common diseases that we see and people, like usually miss it even with primary care is cervical myelopathy, which is a compression of the spinal cord in the neck. And usually those symptoms is mainly balance issue or hand dysfunction, hand weaker, and then decreased ability to walk for distance because of balance. And the pain usually in circumstances come very late, and like understanding this problem from the patient, like not everything contributed to the old age, because these problems, like end up, like you lose your mobility, and surgery is really effective and can help those people.
Got it.
Yeah.
Again, I want to thank our live audience for watching, and if you do have any questions for this panel, please feel free to use that chat. We do have a bunch of questions that came in beforehand, so I'm going to get to a few more of those, but I do want to follow up on the fusion angle, because that is, not that there's a stigma, but when a patient hears fusion, when you say that's what they need, have there been advancements in that particular surgical procedure when it comes to fusion, or is it pretty much the same as it's been the last 10, 20 years?
Yeah, the great thing about me sitting on this couch is I'm the old man here, and so over 30 years we've seen significant improvements in how we do surgery, the techniques.
Okay.
We've seen significant improvement in the implants, the rods, the screws, the cages that we use, and then we've seen different philosophies and strategy of spine surgery that have improved. So it does have a negative connotation with spinal fusion, and many of our patients will come to us and say, I don't want a spinal fusion at all. And we didn't even bring it up because it wasn't
Right.
an option.
Yeah.
But certainly with advancement in minimally invasive techniques, advancements in our enabling technologies, we use a technology called surgical navigation and robotic technology in spine surgery. All of these added techniques allow us to give the patient a better experience, a maximized outcome, and we try to reduce the complications, all of the bad things that can happen with spine surgery, because we want our patients back to living. We want them back to work. We want them back on the bicycle, swimming, pickleball, et cetera. And so things have changed a lot over the 30 years, and I'm certainly grateful that things have changed, because I hope in 10 or 20 years when I need my spine surgery, these guys will be able to do an even better job than we're doing now.
That's not a do-it-yourself procedure, is it?
No.
Yeah, and I'll add, as I guess the youngest, I think, one on here, as Dr. Chua could attest, back in like the 90s when they were doing these fusion procedures, they were taking actually your own bone from your hip and using that as a graft to put in there to get the fusion. I can say I think I've done that maybe twice in my career now, because we've kind of advanced away from that, with the whole point of being to limit the morbidity of the procedures we do, because harvesting that bone is a really painful thing. And so when we talk about advancements in technology, we have advancements in bone graft substitutes and everything, and the instrumentation we use, that now we can get just as good or even better fusion rates without the need to go taking bone from your own body.
Thank you guys for addressing the fusion question. Let's see, someone is asking, and these are live questions coming in, I apologize, I just kind of read them cold. If we can talk about degenerative disc disease. And again, thank you again for our live audience, because I know even if you don't have spine issues, there's probably somebody in your family or a friend that could be potentially dealing with spine issues. So great opportunity to ask some questions like this. Would you guys mind talking a little bit about degenerative disc disease a little bit more?
Yeah, so degenerative disc disease really is not a separate diagnosis than what we've already talked about. Degenerative is our medical fancy way of suggesting wear and tear or the aging processes of the spine. The disc is simply the cushions between the bones of the spine and act as a shock absorber, but it's part of the segment of the spine, which is a joint. So the joints of the spine are really just stacked up on one another and become this very complex organ system that we call the spine. So degenerative disc is usually not separate from spinal stenosis or spondylolisthesis, but it's all sort of part of the bigger package the age-related changes of the spine.
And we did talk, go ahead.
And it's very common, you know, like if you go to like shopping mall and ask, 100 healthy, maybe 60 years old, you'll find almost 80% they have kind of degenerative disc disease. But is that bad enough and start affecting their daily activity or start to take over the space for the nerve? Those circumstances we come and interfere, but it's very common and it's part of life, and you can find it with normal population.
And this is why we shrink when we get older, right? Is that part of that? We're losing that disc space in there?
Kind of, yeah.
Yeah, okay. What is it? You gave me that look.
Our posture,
Yeah, it's posture and that.
posture sometimes makes us a little shorter as well.
Okay.
A little bit, some kind of, the bone will be softener, like osteopenia or osteoporosis can be a factor too, and the disc will be dehydrated and shrink too.
So as we talk about degenerative disc disease, what are some of the treatment options? I mean, is that injections? Is that putting an implant in there? What are some of the treatments for degenerative disc disease?
Yeah, I think it, like Dr. Chu was saying, degenerative disease is really what kind of, it's something that happens to everyone, and if it leads to other conditions, and so the treatment is going to be very different depending on what the degenerative disease is causing. Like he was saying, lumbar stenosis is one of the most common procedures we see. If you have really bad degenerative disc disease to the point where your bones are overgrowing, your ligaments are overgrowing, the surgery for that is very different from spondylolisthesis, where your bone has kind of slid forward a little bit and might be a little bit unstable. So it's hard to say exactly what the treatment for degenerative disc disease will be without seeing the overall picture and what symptoms the patient's having and where their pain is to go down their legs and everything like that, because that's really going to dictate what we do.
Again, a spine is a patient-specific problem. Like you can see people with horrible-looking spine on the MRI, but they are asymptomatic, and usually just counseling them and not offering them, like major. We don't treat the images, we treat the patient themselves and what complaint they come and what they, expectation and aiming to improve their quality of life.
Yeah, the term degenerative disc disease probably in your question is because patients read their own MRI reports, and that phrase is very common. Yeah. But I describe to patients degenerative disc disease as no different than my skin has gotten dry as I've aged, my hair has gotten gray as I've aged, some of the other body parts get stiff and not as mobile, and so it's part of the aging process, and both of them have already mentioned that if we took 100 people off the street who are age 60 and above and we put them all in an MRI scan, 80% of them are going to have degenerative disc disease and have never had an episode of back pain. So we try to counsel patients that it's not about the MRI, it's about their symptoms and their function, especially pain. The MRI just helps us determine if they need surgery or what kind of surgery. But we oftentimes will have patients come in after their MRI and they're already a lot better, and so it doesn't really matter what's on the MRI because their pain is better and they're back to their daily lives.
What a great point, because I'm sure that is a common thing of seeing degenerative disc disease on your MRI and thinking, okay, I've got to treat this as immediate, but it's part of the aging. But what about for younger patients though? Because I know it does show up probably, right, in patients that are 20 or 30. What happens when you see a patient of that age with degenerative disc disease?
Well, I think at that point it's really even excessively important to counsel them and educate them and have them understand what types of activities could trigger back pain in the setting of an underlying degenerative disc. So a lot of core exercise and yoga and Pilates. I also spend a lot of time telling people to back off of some of their activities, treat themselves like a world-class athlete. A world-class athlete, when they hurt themselves, they rest and make sure they can recover. But it's no different than the 60-year-old or 75-year-old. If they hurt themselves, they need to be able to rest and recover. If they can rest and recover within a day or two, they can certainly go back to the activities. But I think where we have a problem is even in our younger patients where they don't listen to their body, they don't let themselves rest and recover, and they just blow right through the pain, and then they cause more injury and more problems.
Okay, you had something to add on?
No, I agree with Dr. Chua. It's all about kind of talking to the patient and seeing, what they want to do. The recovery process of someone who likes to do triathlons is a lot different than someone who just wants to be able to garden in their home. And so you have to tailor your treatment for those people specifically.
Okay, I'm going to ask the question that all of us in the studio during tech rehearsal couldn't wait for you guys to answer this question. Okay, is cracking your back or neck a good idea, healthy choice? Any suggested alternatives? Let's go around the panel for this one.
So, like basically, for the neck, anything at the spinal cord level, neck and mid back, it's risky because there's some case report that showed people can get paralysis from those kind of cracking. And if it's part of stretching in the lower back, I think it's not a bad idea. But any cracking come with pain, I think it's not a good idea. So
Okay.
yeah.
Good.
I've actually had a patient who used their two hands to crack their neck, and they caused a herniated disc that required emergency surgery. So I have personal experience that can be bad for you, and I would agree. Anything sort of in the upper spine, anything that's related to pain, related to popping and cracking, probably shouldn't do. However, it's very common for every bone and joint in your body to make a noise. Your knuckles, your toes, your hips, including your spine. If it's not associated with any pain or dysfunction or loss of range of motion, it's perfectly normal.
Yeah, I think we got to differentiate between like what we do when we do like those sudden manipulations with your neck and everything, and just like Dr. Chu was saying, the pops and cracks that come with stretching. Like I love to foam roll, and when I foam roll, my lumbar spine just cracks in 10 different places. Those I think are fine, but when you're really just on jerking to cracks, and that's when we run into the dangers of those disc herniations or further injury.
Okay, everybody got that? Everybody good? Those answers? Okay. We have some questions coming in live. Okay, good question here. Are cervical spine issues ever related to headaches?
Sometimes if you have spinal stenosis up high, like on the cervical spine, can be causes of the headaches. But usually, it's not like come as a part, like only symptoms. So we as a spine surgeon, we look to the more things like hand functionality, any weakness in the arms or leg, any change in the balance. Those can be, but more. In very, very rare occasion, other things that I can mention is arthritis or between C1 and C2 is very high, can cause some referred pain and as headaches, but not every headache is come from the neck. But usually we exclude other reason that it's more, more serious.
And many patients think that the spine and the neck are the same. And the reality is the neck is the spine plus a lot of muscles and ligaments. So the most common condition of neck pain and headaches has nothing to do with the spine and is muscle tension headache. That can be attributable to poor posture, work or life where you keep your head in one fixed position. But in general, cervical spine problems do not cause headaches.
And we've got another great question coming in. Are back issues genetic?
They can be. I think there are some studies that show there is some familial component, with conditions like we were talking about scoliosis, where if some family members have had scoliosis, you might be at higher risk for developing it, but doesn't mean that because your dad or your grandpa had scoliosis means you're absolutely going to develop scoliosis in the future. The best way to prevent it is just like everyone's saying, keep good posture, try to avoid accidents where you're, getting your fractures in your back or anything, staying active are really the best things to do.
Yeah, like sometimes you see a patient, he did surgery, they did very good job, and then, their sister or brothers, or they come like, oh, we have the same problem, but when you check on them, they have totally different problem. Can be hip problem or something, basically tailored examination and questions to the patient complaint, more important that, oh, because my brother had a spine surgery, I should be cured from spine surgery too. So.
Anything you want to?
Yeah, back and neck conditions are so common. They're probably the first or the second most common reason a patient goes to see their primary care provider. And so if you think about generations of families, then it's because it's a common problem, patients start to think that it might be genetic, but in most cases it's not genetic at all. It's what we call sporadic, but it's just such a common condition that my dad had it, my grandfather had it, my mom has it.
That makes sense. Again, thank you for all of the live viewers watching, submitting these questions. These are great. We've got another one coming in. Okay, this is, interesting to hear how you guys handle this one. What are your recommendations regarding chiropractic care?
I think this goes back to when we talk about cracking the necks and the manipulations and everything. Like we were all saying, especially with high cervical or manipulations, in addition to causing disc herniations, spinal cord injuries, you do have two arteries that run in very close proximity to the bones in your neck. And with manipulations, there have been reports of getting arterial dissection in there and causing a stroke. in your brain with those manipulations. You know, albeit it's very rare for it to happen, but if it does happen, it's a very, you know, life-altering situation to be in. And so I tend to recommend to my patients, thoracic and cervical, I tend to recommend not doing any manipulations. Now, there are a lot more things chiropractors do aside from just manipulations. And so I think those are okay. I've actually seen chiropractors myself for my lower lumbar spine. You know, I didn't do manipulations, but they do other things to help with it. I think those are okay. But at the end of the day, you know, it's up to us to kind of counsel the patients on what are the potential risks and complications, and then kind of also let them make their own decision.
Tough question to answer because you have so many people using chiropractic care.
Yeah.
What do you guys think?
I mean, I can't say more than Dr. Do say. As I said, you know, like there's certain circumstances, you know, like one episode can, you know, be a bad things, but, you know, and most of the things that, you know, lower back issues or SI joint things that they really shine the chiropractor and help people avoiding, you know, it's like part of the non-operative methodology, like we usually recommend for people in certain circumstances, but not for everybody.
Yeah, I'm very supportive of patients seeking out other treatment options, including chiropractic care. And as Dr. Du mentioned, they do other things than just spinal manipulations. I counsel my patients, the most important thing is that they should have a trust with their provider. They should ask the questions about why should I do this or why should I not do that. And just like our patients have to have trust in us, and we have to understand to explain the benefits and the risks of the treatment, as long as the patient is comfortable with that conversation with their chiropractic provider, I'm very supportive of it.
Fantastic. All right, as we get ready to wrap up this conversation, we kind of go around the panel and just kind of sum up, you know, as we talked about at the very beginning of this, you know, where we are in the state of spine care and what you guys are most excited about moving forward. Because as things advance and procedures advance, the technology gets better, let's talk about what you guys are most excited about. So Dr. Du, let's start with you.
Well, I'll leave the talking about technology to Dr. Al-Hamoud and Dr. Chua, but I think, you know, one thing I'm really excited about, especially what we're doing here at Banner Tucson, is we're really building a cohesive spine center and spine team. You know, with us, you know, I think we're the only certified spine center of excellence, and what that means is we have a whole team of, from our staff in our clinics, our medical assistants, to nurse navigators to help us get patients through to our residents and our advanced practitioners and the surgeons here. Everyone is working together to get the patients, you know, back to where they want to be. And I want to include the, you know, the physical therapists, the pain management physicians, you know, our PM&R physicians, the chiropractors, you know, everyone. And, you know, we're all communicating a lot better now. You know, it's not just me operating on you and getting back. It's this whole team effort, kind of like sports, you know, to get people back up to where they want to be.
Dr. A?
Yeah, so basically, you know, like, again, the spine problem, you know, like, it's very common and can present it with a different way. So, like, as a, you know, like, for me, I take care of pediatric, like, from day one with simple things like casting to the oldest patient I did is 93, and each patient has, you know, different way to like, basically this procedure can help this certain of people, cannot help those certain people. So basically, you know, like, if you have a bigger problem like spine endoscopy, not for everybody. It's a great procedure, it's ultra minimally invasive, but it's not for everybody. Sometimes if there's a motion, we can, you know, like spinal fusion, and spinal fusion can be done like in different way, like Dr. Chua, like minimal invasive, and we use, like, majority of us, we use like navigation and robotic, and so the accuracy of spine surgery is really high. So basically, you know, I don't leave the OR until I know where's my screws and make sure 100% that everything in the right place, and so it's not like there's the room for mistake is very minimal. So the successful rate is really like higher than before.
Okay.
And yeah, that kind of.
All right, Dr. Chua, wrap us up here. If someone's asking you, maybe in a social situation, what are you most excited about in your field? How do you answer that question?
Yeah, I'm most excited that patients are engaged and are healthy and they want to learn about their condition. They want to prevent themselves from hurting themselves. And because of that, we're all living longer and healthier. So we're seeing patients and doing surgeries on older patients that I know 10 years ago and 20 years ago, we would not have done surgery. I'm really excited about the technology. So it's already been mentioned with navigation and robotic technology and spine surgery. In many instances, we're able to do spinal fusion surgery and patients go home the same day. Wow. Our next generation of technology is going to be augmented reality and virtual reality type of technology that we hope to incorporate at Banner University of Medicine Tucson in the next several months, and that we're just going to take it to another level with adopting technology. Just like you want the next iPhone 15 or 16, we want the next generation technology to make ourselves better.
Fantastic. You guys, thank you so much. What a great panel, informative. We want to thank you for watching and participating. And again, we talked a little bit about this. If you would like to make an appointment, talk to your primary care physician or use the Find a Doc link we have in the chat there for you. And as a reminder, we've been talking about this. This will be available to stream and share with those you know will find this information valuable. So please use the link after the show. Again, thank you so much for watching, and we'll see you again next time.